Hi, I am Dr. Ratan Jha, a senior consultant nephrologist at Care Hospital, Banjara Hills. Today I am going to talk about what are the investigations that one needs to do when we suspect it to be a kidney disease. There are three groups of tests that we do in a patient of kidney disease. One is the urine examination. It is called complete urine examination to see presence of RBC, WBC, CAS as well as protein or albumin. It can be quantified by 24 hours collection, or occasionally we try to do it as a spot sample for urine protein and creatinine. So that is the first urine test, which is cheap test. Second test is called blood test, where we try to look at the common tests of urea, creatinine and electrolytes along with a complete blood picture to see presence of anemia or absence of it. And the third test that we do is a kidney scan, which is an ultrasound scan of kidney. We do not need to do a CT scan in general for making a diagnosis of kidney disease, which is usually done by urologists for stone and malignancy. So three tests that we do is urine examination, blood test and ultrasound examination besides the physical test examination that the doctor has to do. And with these reports, person should report to a kidney specialist, preferably a nephrologist, before he tries to see a urologist.